Apologize, my voice is not strong. So take a look at the board. We're going to do a demo of using different size cups and different style cups on the hamstring to give you an idea of how it goes. What you need? So Austin is here with his hamstring. You ever injured your hamstring? You doing any working out, running, sports? He's a runner. So very common that the runners get the tight hamstring. Sometimes people will get a hamstring strain. They might even avulse part of the hamstring off of its attachment down here at the tibia or fibula or at the ischial tuberosity. Very commonly, if they avulse part of the tendon from the ischial tube, it's hard for people to sit, hard for them to drive with that leg, that kind of thing. It could be very irritable. So I like to do the cupping from the origin to insertion. I see when many of you are practicing, you're just kind of cupping around in the middle, and everyone's being very polite, stay away from his rear end. Well, I'm going to get right in there, wherever he needs to go. Is that okay with you, Austin? So we'll try some different cups. Again, make sure you have some nice lubricant first. I'm warming up my hands a little bit. And typically, if you see some body hair, that's fine. Just use a little bit more lubricant so that you have some nice seal to anchor the cup to the skin. And if you're doing the hamstrings, remember they're neighbors. Iliotibial band comes down here, attaching to the lateral tibial plateau. Gastrocs attaching also on the posterior femoral condyles, deep to the hamstrings. So remember, these are knee flexors here. They're going to influence what happens at the knee. So you want to work with the fascias of all of those tissues. Now, have a towel handy because when you get all greasy, you lose your grip on the cup. And if you have trouble gripping the cup, I'd recommend to use a glove. And it helps to get you a better grip. So if you put the glove on, non-latex, non-allergic, now you mean business. Try different size cups. You see we have a small, a medium, and a large. You could look to see, gee, what size? Well, he's got a pretty muscular leg. I'd probably want to use the large. But I'm thinking, well, we said that the larger cups have greater pressure. And it's his first visit. Do you want to use something with greater pressure the first day? Probably not. You want to start him with something lighter. So maybe I'll try like the medium or the smaller cup. Let's just see how that goes. So you lube up the cup a little bit. Let him know you're going to be doing some massage cupping to his leg to stretch it out. It should feel like a massage. It may be a bit of a pulling, stretching style massage, but it should be comfortable. Or it might be a good sense of strong stretch, but it should not be painful. So I'm just going to let a little bit of air out of the cup, place the cup, and I'll think about my muscles as I'm here. So I'm thinking, okay, semi-membranosus, semi-tendinosis from the medial aspect of the knee, moving proximally. I tend to go toward the heart, especially just assessing to the ischial tuberosity. Suctioning again, right through the middle. So I'm just assessing here, what does the glide feel like as I'm going up and down? Biceps. And where do I feel that there's the most tension? Actually more close to the tendon here, and it pops right off. Can you feel that? So biceps femoris, the long head goes down to the fibula head. When you're over a bony area, it's very hard to get the large cups to really suction there very well. So I might, over that bony prominence, use a little more suction for grip and do a little bit more, get the air out, a little bit more rotational motion to stretch. Feel that pulling? If it continues to dislodge, go for a smaller cup. Lube it up, take the air out, place. And the body hair also is a little bit of a challenge. And I could get more into that area around the fibula head with the smaller cup. Feel how it's a little softer than the other one? So be aware that you're going to be placing and replacing the cups as you go because it tends to lose some of the air if you're over a bony prominence or a hairy area. That's why I like to use cups with the pump. Pumping cups have a pumping gun that will suck the air, and then they pop in and out of. This is all on the board up there, if you look. So we have a pumping gun. You pump air in and out, stick them up. And then you have this tiny little piece on the top of the cup. I need to get a little bit closer there. That lets air in or out. Attach that to the nozzle. Glide the cup over the skin, and then choose where you want to work, and then just gradually pump And you could see the skin ball up very clearly through the plastic cup. Feel the difference between this and the other cup? What feels different?
This one's a lot more pressure.
This is a lot more pressure. I could let some pressure out by just getting my finger underneath the cup. Start again. Place the cup, make sure there's plenty of lubricant. Little bit of pressure, little bit more pressure. So feel where you get good drag but not uncomfortable feelings for the patient. If I did more pressure, I don't think I'd be able to hold this for him. How is that for you? And then you could switch hands, don't just be one-handed all the time. It dislodges, just replace it, put it back again. They don't always hold the whole time. And especially if you get oil on the tip. Try not to get oil on this tip right here. There we go. Now this one also has a magnet in it. That's what you see, that blue stick inside is a magnet at the end for anyone interested in magnet therapy. It's not necessary. It's just one of the things that you get with the Asian bodywork cupping from China. So get into those tendons. He's pretty tight right in here. I like to think of doing a little transverse cupping across the tendon, like a transverse friction massage. So you break up some of the tension in the fascial planes by going between the layers of the tendons, restoring some tendon glide. Wow, that's really tight right there. How are you? He's good. He's barely breathing, but he's good. So you think patients might like to focus on their breathing when you're doing some of this work?
Yes.
Yeah, I think it's a great idea. Have them do some diaphragmatic breathing. So rather than just glide the cups, I'm feeling for what spots feel like there's a lot of tension. So behind the knee here for sure. Right here, semimembranosus, semitendinosus. Really tight. And if there's a trigger point, you might want to leave the cup there for a few minutes. Some of the studies that show even leaving the cup for 5 minutes can decrease the painful trigger points. And there's also some fascial crepitus. If I come down through the biceps, bump, 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 it feels like I'm going up a staircase because there's some fascial crepitus. That's a sign of fascial restriction. If it's too bumpy, just turn, turn, turn. So I turn a little bit to ease the glide so it's not so bumpy going up that staircase. Feel the difference? Make sure to get into the ischial tuberosity as well. That's another attachment. We don't have to show it to you. It's underneath the towel. But I could get right under there with the cupping. Iliotibial band. That can be very, very sticky on people. Gets very tight. Often the doctors will do a lateral release. Why not get in and do some cupping instead of sending them under the surgeon's knife? Get some cupping in. Think about your ergonomics too, how you're holding the cup, your table height. This table's definitely a little too low for me, so I might actually be better off getting in a chair. And he's so tight at this part of his IT band, I have to really pull with quite a bit of effort. You feel the difference? That's really tight. So that IT band is a little adherent to his biceps femoris. So I'm just feeling which way I get a good stretch. So that shows you how to work with a little